A very common injury that we see in the office and in the ER is ankle sprains. When you turn your ankle, like this most commonly, that's called an ankle inversion injury. And it's common in tennis, which makes sense, but also common just walking on the street if you step in a pothole or step funny on the curb. And so basically you can tear or stretch the ligaments on the outside of your ankle, most commonly the ATFL or anterior talofibular ligament. And what happens is you get a lot of swelling and bruising depending on how significant the tear is. The best way to treat this is with rest, ice, and elevation, but then after that, doing physical therapy can really help promote healing and help improve something called proprioception. Proprioception is the ability of your brain to tell where your body is in space after an injury. So an ankle sprain disrupts your brain's ability to tell where your ankle is in space. This can help cause further ankle sprains in the future if you don't rehab it properly. So make sure you go to physical therapy where they'll do proprioceptive exercises to help improve balance and stability in the ankle, as well as take anti-inflammatories, rest from your sport, and then consider bracing or kinesiotaping after the injury once you're getting back to your sport to try and prevent re-injury.